Yep, we're going to call this insurance committee to order October 5th, 2022 at 9:30 in the county commission room. If everyone would, please bow their head. We'll pray and then have the Pledge of Allegiance. Father, thank you so much for this day. Thank you for all your many blessings. Thank you for allowing us to be here today to work on behalf of the people of Bradley County employees. We give you all of our we thank you for all of our blessings and thank you for all that you do. In Jesus' name I pray. Amen. Stand. Attention, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We are currently waiting on one more member of the insurance committee to get here so that we'll be able to have a quorum for this session and be able to make recommendations going forward. I do want to welcome committee member Tommy Ledford here, County Commission Chair Thomas Cry, County Commissioner Mylan Blake, County Commissioner Scott Gilbert as well for being here. Thank you all for being here as well that are going to be talking to us today. The only agenda item that we have on today's meeting is the county employee health insurance renewal for 2023. And at this time, I'll turn the meeting over to Gary, or recognize Mayor Gary Davis.
Okay, thank you, Commissioner. You have a spreadsheet in front of you that we'll get to in just a minute. But wish everyone was here, but I guess for the sake of Tommy especially.
And Mayor, excuse me for 1 second. Bobby is here, so we do now have a
all
quorum
rise.
for this
Bobby
meeting.
has arrived. How you doing, Commissioner Goins? Does he have a spreadsheet? Give him. Did you have two, Tommy? Okay. All right. I'm going to go. What I started to say is I'm going to go back in history for the benefit of those who haven't been on the commission or the committee in the past and repeat myself about 50 million times because it never gets comprehended. We have bid the insurance again this year. We have bid the insurance again this year. Every year I get accused of never bidding insurance, and we bid it almost every single year. 2 years ago we did not bid it because we got an offer of a 0% increase, and anytime you can get insurance renewed, I just paid my homeowners yesterday, and I looked up, and you wouldn't believe the percentage. Anytime you can get a 0% increase on insurance of any kind, you better take it and run. 2 years ago, we got 0. We took it and run. I went through the process. You all approved it. But that year, we did not bid it. But we bid insurance every year, health insurance we're talking about today. And we did again this year. We began the process back in September, trying to get the renewal rates. And, of course, getting the claims histories together from Cigna or whoever the provider is at the time and sent out to the various companies is a time-consuming challenge. But it started the 1st of September, and we sent bid requests to Blue Cross, Humana, United Healthcare, and also the state of Tennessee, as well as the renewal with Cigna. So you had 1, 2, 3, 4 companies. I had a commissioner one time that said, well, why didn't Allstate get to bid? Anybody can bid, but I have a very long track record. Basically, only Blue Cross and Cigna can do this. United Healthcare provides a bid sometimes, but very rarely, and the others don't. Somebody even asked about Aetna yesterday. In some parts of the country, Aetna might, but not around here. They never have. Your commercial companies that you tend to think of going up and down the street cannot bid on large packages like this for healthcare. I mean, they can, but they won't. We've had a few. One year I had a Nationwide, that's on TV all the time, requests the claims history. We got the claims history together for them, sent them to them. They never presented a bid. They just usually can't do it. So it always comes down to basically Blue Cross and Cigna. This year, when we got a bid back from, first of all, we had an offer to renew from Cigna of 5%. A pretty good offer, but we still bid it. We requested bids. We got a offer back from Blue Cross with Cigna offering a 5% increase, they offered to write our insurance for us at a 13% increase of what we're paying today. 13%. And we went back to Cigna, which was the low bidder. First of all, Humana got the packet, they declined to bid. United Healthcare got the packet, they declined to bid. State of Tennessee, talk about that in a minute, because a lot of you hear about State of Tennessee health insurance. We've been with them 3 or 4 times since I've been here. The employees seem to like it because they have options, like they'll have a Cigna option and a Blue Cross. So there's things in it that employees like. But here's how the state of Tennessee works. First of all, you have to sign a 2-year contract. Let's say they're lower this year. They're not, but let's say they're lower this year. Keep in mind, you got to sign a 2-year contract. What happens every time I've been with them? When it comes renewal, huge increase, and you have no say-so because you signed a 2-year contract. That's how the state of Tennessee will do you. They've done it every time. I'm always asked, why don't we bid it? And that question's based on a lie, because we bid it almost every year. But have you ever asked why schools don't bid it? Schools are on state health insurance plan. You don't have to bid it if you're on state health insurance plan. When I came into office, my predecessor was on state health insurance plan. They never bid it. So I could go the easy route, get on the state insurance plan, don't worry about the cost of the taxpayers, and never bid it, because I don't have to. Legally, you don't have to with the state insurance plan. But that's what happens. They'll send you a notice, oh, by the way, it's going up 13% this year, and we've lowered your benefits. That's happened 2, 3, 4 times. So, I mean, I know that from experience. That happens with others that don't bid it, that's on the state health insurance plan, but you don't hear about it because there's never any bidding. So we have bid it, and on the state health insurance plan, guess what? They offered, they're not comparable, but their premier plan has a deductible of $750. Rates came in at 15.5% above what we're paying now, 15.5. So you can imagine what schools across the state of Tennessee's rates are increasing. They don't bid it, they're on state insurance plan. Granted, I'll say this up front, school, state plan, and our plan are different, but it's the same bureaucracy in Nashville that both of us would deal with. So anyway, state of Tennessee offered to write it for 15% more than we're paying now. Blue Cross offered to write it at 13% more than we're paying now. So we went back to Cigna. Again, we have bid it. We went back to the low bidder and we negotiated for another 2 or 3 weeks, and we got it to a 4.6% increase. Again, I challenge you. Go home and see how much your insurance went up, and I guarantee you it didn't go up 4.6%. So that's pretty good. Now, granted, they're still making money. I have no doubt. I hear from other agents, oh, they're making a lot of money. Yeah, they are. They're in business, just like these gentlemen are, to make money. But a 4% increase in insurance this day and time is unheard of. The average Biden rates of inflation right now are 8.6. So 4.6. So we negotiated it down to 4.6, apples to apples. The sheet you have in front of you, option 1, nothing changes. There's one change throughout, and we're offering a 3-tier plan. You don't have one? I thought he gave you Tim Mason's. Adam, would you give this? Well, whatever. You got one now? You got the right one?
Yeah, I gave him.
I lost my train of thought. Okay, we are offering a 3-tier plan. We've had requests from employees over the years. A 3-tier plan makes family cost more, but to the employee who doesn't have a true family, they're single parents and they're an employee plus 1 kid or something like that. So the 3-tier plan helps people that are in that situation. So the 3-tier plan is offered across the board in this spreadsheet. Other than the 3-tier plan, which only affects, it don't affect the cost to the county of the employee, but it does affect the family. So option 1 stays the same. That's the local option, local plus network. I call it the I guess you would say the best option. It's the most expensive option, other than option 3, and we'll talk about it in a second. Option 2, no changes. That's the one that includes HSA, a very Smart option. Not too many people take it because they don't want to deal with HSA. But if you would deal with HSA, it will save them money, but that's their prerogative. In the HSA, what's written down at the bottom is we put in the HSA $50 a month for that employee. The county does. So they get $50 in their HSA by the county, and then if they'll match it with $50, that's $100 a month. They can almost pay probably for all of their normal expenses with either giving money from the county or pre-tax money. But we had a lot of requests for that, and not too many people take it, but we started offering it a few years ago, and it's grown a little bit, so that's a good thing. But no changes, so I'm not going to go down the individual benefits because option 1, option 2, and option 3 has no changes in benefits. Option 3, just so you'll know, the history there is about 3 or 4 years ago, Cigna was negotiating with Tenova. Negotiations fell through during that time, and all insurance companies have these negotiations with hospitals from time to time. Well, that particular year, they were negotiating with Tenova. On a daily basis, I hear how I don't like Tenova, but whenever Tenova didn't sign a contract with Cigna that year, employees went crazy. We're going to have insurance. We can't even go to our local hospital because they didn't have a contract with them at bid time. We knew they'd get it worked out, and they did, but they didn't at that time. That year, when we bid it, Blue Cross took advantage of the situation and came in as a low bid. So we switched to Blue Cross. Why did we switch to Blue Cross? Because we bid it. I'm going to say that a million times, Mylan. We bid it. Blue Cross got the bid that year, and we went with them a bid. Now, I also gave Finance Committee a heads up. They're the low bid. We've got to go with them, but my history with Blue Cross is this. They're a lot like the state. Next year, they'll put it to you. We were with them a year, no problem. We saved money. It wasn't a bad decision, but the next year, their renewal was out the roof. So we bid it again and ended up going back to Cigna, and that was when the issue with the hospital was going on. But they came in with what's called a Local Plus Network, and the Local Plus Network didn't include Memorial or Park Ridge and doctors that go along with those hospitals. A lot of our employees said, I don't want a plan that don't include Memorial. If I get sick, I'm going to Memorial. Don't understand their thinking, but that's a lot of people feel that way. So we offered them option 3. The difference in option 3, the big difference, is it's called open access. It includes everybody. Since then, Cigna has negotiated Memorial, and they're part of Local Plus. So option 3 is no longer needed. Option 3, you have to buy up. It costs you $39 a month to buy up. That's their choice. That was some way to do it in order to have Memorial. Well, Memorial is now in our Local Plus network, so there's no need to buy up for Memorial. The only reason to buy up now is if you want Park Ridge. There's still a few in option 3. I don't know if it's because they haven't took time to come to the meetings and find out that Memorial is in option 1, or what the reason, or maybe they love Park Ridge, but they're paying $39 a month more by choice. Now we go to a new option this year. 2 things we're accomplishing this year is this. 3-tier system that's been requested for the last 2 or 3, 4 years. And we've had a lot of requests for direct primary care. We're able to provide option 4. Option 4, from my perspective, gives you a lower cost family coverage. Everybody says family costs too much, and it does, I understand. If anybody compares us with the city, the difference is the city pays a huge amount of money toward family. We don't. We provide free to you. If you'll notice all the way across, employee, free, 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 free. Every option's free, but we don't provide family free. They pay for it. Option 4 is less expensive family, and here's why. The benefits, it's not that they're less benefits, they're higher deductibles. They're higher deductibles, but in option 4, you have a direct primary care doctor, clinic, whatever you want to call it. And they're here today to tell you more about that. Some of our employees are actually subscribers to this service as we speak. You pay a membership to them, and you can go to their doctor or their office as many times as you want to a month at no cost, and a lot of prescriptions are offered. Again, they'll go in more detail in a minute. So if you take option 4, well, the reason I couldn't do it before is I couldn't figure out a way to pay for it. A direct primary care clinic option by itself, in my opinion, is no good. Employees wanted that, but what they didn't understand, if you went out here and had a car wreck today and you ended up in ICU, that direct primary care physician is not going to help you a bit. You have a heart attack, even though you're just 35 years old. It can't happen. You have a heart attack, that direct primary care physician is not going to help you a bit. He may say it a little differently, but I'm just more to the point. So what we did this year is we came back and we said, Cigna, we want to provide a new option. We want it to be high deductibles. If it fits into their situation, they can take option 4. They can go to the direct primary care physicians as many times as they want to. If they take family coverage, they and their family can go to the direct primary care physician as many times as they want to, and it is no cost because we're paying the membership. How are we paying the membership? And the difference in the cost of the 4th plan of Cigna versus 1. So you take the higher benefits. Now, why would you want to take higher benefits? Well, if you're young, your kids are young, you're all healthy, direct primary care physician is going to take care of 100% of your needs unless you have an accident like or a heart attack or something. And if you have that, then you have a high deductible plan to kick in and take care of you. Does that make sense? So we're taking care of the employee, even though some of them didn't want to be taken care of. I had some come to me, just pay for my membership. I don't want you stupid insurance. And, you know, I just want to, if I wasn't being watched and recorded, you can imagine. But I couldn't do that. Some of them, I think, have taken it even though they have our insurance because they want to be able to go as many times as they want to. But the good thing about option 4 is they can do what they want to, and it's a good thing. The direct primary care, you can take your kids, if you're on the family plan, as many times as you want to. They provide many of the prescriptions for you, colds and things like that. They're going to take care of it. But we're also providing you an insurance plan in case that emergency or that situation like a heart attack happens. And that, as Dave Ramsey would say, if you don't insure for that, it's going to happen. So that's the good thing about option 4. It's something that you as commissioners ought to be happy, excited about. We're offering a new option that will provide the direct primary physician to our employees like a lot have wanted, and it will be a good thing for those. I'll use myself as an example. I'm getting older now. I don't know that it's the best option for me. It might still be. I'm not saying it's not, but it gets more questionable. But if you're Adam's age and you got 2 kids, you got insurance to cover those wrecks and heart attacks in case they happen. Direct primary care physician probably option is going to, I say, be ideal for him. You follow me? So there's going to be a lot of employees that this will be a good thing for. The challenge, and we're going to have a meeting with elected officials and department heads, is get people to come to the meetings. Another thing, they complain about health insurance because they don't understand it. Usually they don't come to the meetings. But if they will come to the meetings, these guys will be there to explain how direct primary care works, and if it's the right thing for them, then they've got another option that will cost them nothing. And again, if they take the family plan, the price is a whole lot less than family plan on 1, 2, and 3, and they have direct primary care membership provided for the family also at no cost. So it's a really good option that I'm excited about adding. These guys haven't liked me for 2 or 3 years because I wouldn't do it, and it's because I couldn't afford how to pay for it. You know that. But we finally figured out a way to pay for it, and so I'm excited about the option. The challenge now will be to get the employees to look at it. And then to get the employees to look at, they probably don't need option 3. Why are you paying more for it? Unless you're a Park Ridge lover, you don't need option 3. And then the employees that say, well, I just got 1 kid, I'm a single parent. We now have the 3-tier system, so it takes care of that. So all in all, it's really good news, in my opinion, what's in front of you. So I got the bidding, got the history on the bidding. What we did this year, I talked about the changes, which are improvements, the 3-tier system, a direct primary care physician. I've gone over that fairly quick, but is there any questions from any of the commissioners about any of this? We'll get as specific as you want to. But.
I do.
Okay.
So if an employee takes option 4, with the direct primary care and they're already a member, and I guess this is more directed to the direct primary care people, and they're already a member of direct primary care, will they be able to cancel their current policy with you guys without penalty,
Yes.
without anything?
Yeah, the way that we handle those situations are we just make it seamless for them. We'll communicate with the patient. A lot of times they communicate with us before we get a chance to get a hold of them, but we move them to the employer-funded program.
Okay. The next question I have too is if you take option 4 and they say, we want option 4 because it's a cheaper insurance plan, the deductible might be higher, but the out-of-pocket cost monthly is cheaper, I can still keep my same doctor. I don't have to come and see you. Is that correct?
That
Miss-
is,
Right.
that is
It's
correct.
just going to cost them more than if they were one of the other plans, but it's still there. Yeah.
But you still have the same access to the same exact doctors that you're currently seeing. But you do have the option for the free coverage with you guys. Okay.
So how we address that, and that comes up a lot, and I appreciate the question. How we address that is we fit in exactly where your employees are, all right, where the people who work for the county. If they have a primary care physician that they've been seeing for 20 years or for 2 months, it doesn't matter. That's fine. But bring to us their orders, and you'll hear about us. We'll get a chance to explain this a little bit more. But if they order something in the office, EKG, labs, even medications, that's going to go either towards your deductible or towards your copay. Bring those to us. We'll do them for you so you don't have to, and we'll send it right back to them. Your standard routine stuff, follow for blood pressure, cholesterol, diabetes, asthma, go see them. All right, but if they write any medicine or they need any labs or they need an EKG, pulmonary function test, that's all included in what we do. So your folks are not going to have to pay for that, even if they do. If they're sick, all right, let's just say, hey, I have a regular primary care. I call them and they can't get me in for 2 days. They can call us. We're going to get them in the same day. All right, so again, it's one of those, use us for whatever it is you need. Use us for as much as you want or as little as you want. What we become is that employee's standalone clinic. We now become their clinic. If they need anything, they can come to us. If they have any questions, they can come to us. We have a communication system which makes it easy for all the people who sign up for us. If they've got a question, it literally is as simple as picking up their phone, pulling up their app, sending us a question, a text message, and one of us answers, either our nurses or our providers. So if any of those questions come up, the simple answer is all they have to do is ask us. They don't have to leave their person that they normally see, and they can use us for whatever it is they need it to use us for.
I've got one final question before Mylan, if that's fine. Mayor, if you sign up for option 1, option 2, or option 3, but say, hey, I want direct primary care, can you sign up for direct primary care through the county or no?
The question is, will we do automatic payroll deduction? And I haven't gotten the answer yet. The real answer is, yes, you can still go buy your membership from them. We're going to start getting requests, can we do payroll deduction? And I don't know for sure that answer yet. Let's assume no until I find out. But
Okay.
probably you can. They're going to want us to, that employer, but they got to put some common sense into it. If they want to use these guys, why wouldn't they save money and take option 4, period? But then it's totally free. But we may be able to work that out. I'm just not sure.
Okay. Mylan. Question?
Cigna, will we have their own contract with these gentlemen? So there'll be two different contracts, or will it be?
They're gonna, at some point, they'll have a contract agreeing to charge us X dollars for single memberships and X dollars for family
And it'll be
memberships.
renewed every year, just like Cigna has to be renewed
Yes.
every year.
And the only thing that we're doing there is locking in the negotiated price with them. We could have got a better price, but we can't guarantee them a number of how many people will take the option.
Well,
So it's sort of a gamble on their part, but we do have a price agreed to based on we don't know how many employees we'll get.
And on that sign up, I mean, we're getting ready to soon start the enrollment process. Usually it's like the first week of November, whatever dates. And I do hope that everybody shows up to and gets educated on that. But do they have to agree, because they're going to be deciding what option they want. So you'll have a kind of an idea except for employees that get hired after, what they call it, a change in your status or something like that, when you can change your, sorry? Yeah, qualifying change or something like that. So yeah, that kind of leads me to another question on that. So estimate about what 650 employees is what we usually go by in the county, and their family members as well. So I guess I'll just ask, because I think it will be asked, is 650 plus their employees is a lot of people that are going to be put onto your services, and you're going to have to be staffed accordingly. I mean, I guess starting January 1. So I guess my question is, are you ready for
Yes, sir.
about
Yes, sir.
a thousand patients coming
Sure.
to your facility?
That would be a great problem to have, assuming. that
Sure,
we're
I get
gonna-
it.
I can tell you that, historically, we'll probably hit about 30%. That's the number that we've gone off of. We are appropriately staffed, really, as we are, now. We never get too full, if that makes sense. We never reach a maximum, because we get to a certain point and we hire. To understand how we do business is not like your normal family medicine office, urgent care clinic. We actually limit the number of people that our providers see. So what that means is they're assigned 600 patients, and that's all they see. When that happens, we hire somebody else. Actually, when they get to about 400, we hire somebody else, because we know more are coming.
So you have a threshold on that? Yeah,
Yes,
yeah, okay.
yes. And it's built into our system. It's built into our operating system for growth, if that makes sense.
So the kind of incidents or treatments that you are zeroing in on, what happens if they're out of town? Like right now, half of Cleveland's gone, right?
That's a part of our talk track that the county employees will get. It doesn't matter where they go, they have access to us 24/7. If you go to Hawaii, you forget your blood pressure medicine, you can call us. And you can say, I'm in Honolulu. When I can look on our system and say, okay, Walgreens Pharmacy is right around the corner from you. I'm going to call you in a 7-day supply. Go pick it up. Have a nice day. Now, you may have to pay for it from that pharmacy if we've already filled one of your medicines, and we'll explain to you how that goes. But if you're sick, with our new prescription program, we can call you in a prescription. You can take it to any pharmacy, and you can get your medicines there for free. If you go to Panama City, this happens a lot, especially during the summer. I get sick, I'm throwing up, I have motion sickness, I forgot my scopolamine for my cruise. We call it in to the pharmacy that's closest to where they are, and they go pick it up.
Or if you get a broken ankle or something like that, right?
If you get a broken ankle, that's a different story.
I'm just kidding. That was
Can't take
that
care
was
of that
an
one over the
internal.
phone.
So Pam, that kind of leads me to the next part here, and you're absolutely right. I think education on this is going to be key, because I don't fully get it all, and I'll be interested in some of those questions, and it probably is. The FSA, we still have that, right? So if I'm in Hawaii, like you,
HSA.
sorry,
We have HSA.
we don't have FSA,
Yeah, you,
right? So if we're in Hawaii and I need, you did your part, and I went to Walgreens in Hawaii, and I needed whatever, then my FSA can cover that, right?
Yes, also, and of course, since they have Cigna as their base health insurance plan, that would also cover for something if you're out of state.
That is pretty good. The last thing, all right, a lot of our employees, obviously, their spouses work at another company here, and their company is entered into your program. How does that work when you have basically husband and wife kind of deal, and that both their companies are members?
One or the other picks us up. We don't double dip. We don't
Okay,
take,
so basically, the employee needs to make a decision on what option is best for them, knowing what they know that their spouse has this plan.
correct.
Very good. Mayor, the next question is, I guess I'll ask you later on. It's about that rebate we got. I guess you call it the Obama. The one good thing about Obama is the rebate, but we can chat about that later.
no,
Thank you,
we
Mr.
haven't got
Chairman.
one this year. I should have just went ahead and did the direct primary care, but I was wanting to get the more basic insurance out of the way. We talk about 650 employees, about 550 are actually insured with us. That means several of them have spouses that work somewhere else with insurance, that kind of thing. So and right now the division is 425 in option 1, 36 in option 2, 86 in option 3. So like I said earlier, at enrollment, these guys will be there to explain option 4, and we're not trying to sell it to employees, but they'll have the opportunity to sell it to them, and if they will come to those meetings, I think there'll be a big number that will do that. And we're gonna try to encourage elected officials and department heads to get them there. Most of the complaints I hear from employees, that elected official at that department could have handled it, but he refuses to, mainly because he didn't come to the meeting, he don't know the answers either way, so the easy thing is refer it to the mayor. There'll be a lot of questions when it comes to option 4 this time, so if I was an elected official, I would make sure my departments came to see these guys, so, because it might be the perfect fit for their situation. Do you have another question,
Yeah,
Mike?
real quick, Mayor, we don't offer benefits to our part-time employees, but if there's a part-time employee that was willing to pay out of their own pocket, but through our medium or through our channels, would that be a possibility?
If we offer the payroll deduction for membership of someone who's not in option 4, then it would include them too, yeah.
Cool.
That's an if, because I'm not saying that yet.
So, thank you, Mayor. So, from looking at this, our three options, our first three options.
Let me interrupt you before I think of it.
Yep.
This came up before. If we do a payroll deduction, it's not part of the cafeteria plan. It's not a pre-tax deduction. This does not qualify as a health care cost, so it's not a pre-tax deduction. That's probably what he was thinking. But that don't mean we can't do it as a payroll deduction. We had those requests some time ago. Some entities actually did it that way, and they got fined because it is not the correct way to do it. And for those that don't, if you're familiar with the cafeteria plan, there's qualifying things you can deduct pre-tax, which lowers the amount of tax the employee pays. It lowers the amount we have to pay. You had a presentation when we were down at Bradley when the courthouse burnt, and this insurance company came to you and said, man, I can provide you free insurance. All you got to do is do this. Well, what he was talking about was the cafeteria plan that we've been doing for 25 years. The cafeteria plan does lower our costs. It lowers your costs in taxes, but this membership does not qualify for that. So if we do a payroll deduction, it would, if you look at your sheet, some things are pre-tax, some aren't, and it would be one of the aren'ts. Sorry to interrupt you.
No, you're fine. So from your presentation and what you've gone over, options 1, 2, and 3 are really staying the same.
Right.
We're adding in the employee plus 1 option for all plans.
Right.
And then we have this new option 4. So I do appreciate you guys being here today, because this is the kind of new option that Bradley County will probably have the most questions on, and the people will have most questions on. One question I do have for the direct primary care guys is, at what age do you guys start seeing patients?
2 years old and up.
So you guys, you see children and you guys do x-rays. Another question that I have is the medication list. Will you guys be able to provide that to the county to where people can see, or is there a way to figure out what medications, what testing, all that kind of stuff that comes with this option? As someone who is a type 1 diabetic, I'm sure there are probably things on there that you guys don't provide for free.
That
like,
brochure lists them, doesn't it?
and you guys have a brochure.
They will give the employee a brochure that will list what's provided.
One of the options that we've worked on, and actually you guys, the county, and you know, I don't know at what point maybe we were going to be able to present that a little bit, so I don't want to get ahead.
You're talking about the buy-up.
Actually,
Don't confuse them with that.
I'm not
These are
going
what comes with the membership. You can,
actually,
I'm not going to be part of that, but you can buy up with them and get a bigger.
we actually took that out for you.
Okay.
We're just going to include it in.
Oh,
in
okay.
the price.
I wasn't sure what the final was on that.
I'll tell you why. Listen, just so you know, so you guys know, the mayor absolutely haggles these prices really, really, really well. Let it be known.
He got a call as late as yesterday, folks. True story. You need to lower it $2 more if you want it to work. Adam laughed. I said, no, you're going to request it because that's where we're at. We're $2 off here. And, you know, I know he was chuckling on the other end, man, who is this guy?
Listen, he absolutely shops and is a very great negotiator. That being said, The covered medicines are on our standard covered medicines are on a list there, but we have developed our own, and you guys are the first ones actually hearing about this. We've actually developed our own direct PBM. PBM is a pharmacy benefit management program. In there, you'll see something that looks like this. Your employees with us are going to have access to over 1,000 medications at no cost to them, 1,000 generic medications. These medications range, and you can look at everything from antipsychotics if they're on psych medicine, even if they don't get them from us, okay? They're going to have access to this. They also have access to, and this is by mail order. And there's always a caveat, right? There's always an asterisk. You know, what's the hitch? The hitch is it's going to be home delivery for the chronic medicines. For acute medicines like antibiotics, eye drops, ointments, Z-packs, steroid packs, that sort of stuff, you can go to any pharmacy and pick those up. And they're going to get our patients are going to get their own card, their own membership card for that program, so they can get that. So, Chairman Rogers, if you want to look through that list, and I know it's tiny, but that's the best way we can fit all the medicines that we cover on, 5.5 sheets. But, and that's at no cost, no additional cost to their people, no buy-up.
Good.
And all these medicines are free.
Don't cost them a dime.
If you're a member.
If you're a member. If I'm taking medicines currently prescribed by another doctor that are not on this list, will you work with those patients to
Yes.
try and find a new solution of medicines, or can we still get the medicines that we need prescribed through you guys and be able to pick up at our local pharmacies?
Yes.
Okay.
That answer is yes. Yes to all of those. Yes, we work with our patients to find the lowest cost. Yes, we look at branded medicines to get the discounts to the patient. Sometimes that's just as easy as going online while you're sitting there with us and filling out the patient discount forms. Sometimes it's the pharmacies, and we work with local pharmacies mostly, guys. We don't send very many people to Walgreens, Walmart, CVS. We drive our patients towards our local pharmacies because they're our neighbors, and they're people too, if that makes sense. And they work with us, and we work with the pharmacies that work with our patients that get them the lowest cost, that know deals and know discounts that maybe we don't know. Because sometimes these branded medications, they will give pharmacies discounts where they don't give them to us or, out to the public, to the patient. So we stay abreast of those situations, and that's, one of our, I want to say, market differentiators. That's one of the little things that we do that's different than everybody else. And we do that because we have time. Again, if I can, I would really like just a few minutes, if I could, Mayor and Chairman, just to kind of describe kind of topically what
And that's good,
CDC
and
is.
give your location. Let me throw one thing in before you start that. I was talking about bidding. We didn't actually bid per se this particular service, but there are two in town, Direct Primary Care Associates and Direct Primary Care Center. Okay. There's a little bit of difference in the name. I don't know how they're allowed to have two names so close, but anyway, there are two companies that sort of do the same thing. We did talk to both of them. And back to the negotiating part, if you don't choose to negotiate, you get off my radar, and they didn't choose to do much negotiating, so I said to heck with them, and we went back to talking to these guys. So we did look at both. There'll be somebody asked that. And your location's where?
Our actual address is 2626 Peerless Road, but we're really right across from St. Therese Catholic Church.
Yeah, in that little.
Right behind Caldwell Banker Realtor. That's Klingon Ridge Road, really.
So it's a central location, and again, while I think of it, and then I'll shut up and let him have it. Larger communities, I think Hamilton has, Chattanooga, has gone with a total clinic for their health care. That's a big step at this time, but this might be the step in that thing. You will be going to their place. After you get so big and so many members, they'll actually come to you and have a clinic here. That would be the ideal one day. But no, we can't do that next year, so don't try to sell that. But you understand what I'm saying. You will hear about that. Now, also, while I think of it, the city of Cleveland, we've been working with these guys somewhat for a long time, but just couldn't ever get there. The city of Cleveland got the jump on me because they knew we were looking at it, and they started this program, similar program, in August, I believe it was, with the same gentleman. Their insurance package is similar to ours, and they have a new option that includes this also that's very similar. Yes, sir.
Mr. Fretwell, if you wouldn't mind, let me ask these gentlemen here if they have any questions
Sure.
before we get into Commissioner Goins.
Hey,
Just a couple questions. I'm familiar with these doctors here. I'm getting off of benefits just for a minute, if we may. Dr. Mazza, of course, I worked at the hospital, of course. I know the PA Chin, of course, he was a nurse in our ER. I don't know I've ever seen you before, but I see you're a PA also. You have one family nurse practitioner, this Miss Flowers, is that correct?
yes.
Let me ask you a question. Whenever orders come through, and whatever it might be, do you have to get right off by the MDs? Or can PAs do the whole kit and caboodle?
We have Dr. Coker in there as well. He's at our Cleveland office as well.
Yeah.
You know, per the state law, 10% of
Yes.
our charts have to be signed, countersigned, not all. So does that
Only
answer-
medical people would know that. A lot of people think a PA can just do whatever, and they can. I'm not saying that. I'm just saying, I know that's important. People think it's not important, but you get both your MDs gone on vacation for a week, and then what do you do?
Well, again, we can practice independently. A physician does not have to be in the building. A physician really doesn't even have to be in the state. They just have to co-sign 10% of our charts. Within the family medicine arena and the urgent care arena, there's really, I've been practicing here for 20 years,
Yeah.
and I can tell you, and
I've seen you, I think.
yeah, and I worked in the ER here
Yeah.
for 10 years. I can tell you I worked in the ER by myself, you know, when the doc would go, you know, on break or, there are times when PA nurse practitioners are, you know, practicing independently. As far as outcomes goes, we track everything. We have data tracking, we have outcomes management. We have 92% of our patients to goal, which is unheard of. We have a 100% patient satisfaction survey, and we'll do that. And that's information that you guys, although you've not asked for it, you're going to get it. That's just part of our data tracking. That's our outcomes tracking. Because coming back to what it is that we do, if we don't provide excellence in care, we're not going to be here. You know.
Hey, please don't
I didn't
think
take
I'm
it.
criticizing. I am not, because I work in the ER myself. I worked in surgery for 30 years, and I know that PAs are the stuff because they deal with it daily. Unlike that doctor that basically signs off on whatever in ER, of course. But hey, not criticizing PAs because they're the backbone. I don't know if you know Barrett Schichtel that used to work up there with us.
Yes.
Excellent PA. I mean, anytime I go down, if I'm sick for some reason, I choose who I want to see
Sure.
because I know who's going to give me what I want, you know, because I know what I need
Right.
when I need treatment for whatever it might be. But anyway, not knocking you guys at all. I do have a couple questions that is not benefits wise, and I just comments, I guess, maybe to the mayor. But thank y'all
Thank you.
for what you do.
Do you, Mr. Goins or Mr. Ledford, do you have any more questions? No. At this time, Mayor, I know that Mr. Ledford has to leave here in a few minutes. I'd like to go ahead and we can continue to ask questions going forward, but at this time, I'd like to entertain a motion for recommendation to the full commission to approve these four options for health insurance for the 2023 calendar year. Motion first by Commissioner Lefford, second by Commissioner Goins. All in favor, please say aye.
Aye.
Aye. None opposed. We will have a recommendation for the work session that we put on the work session on Monday. Will be brought up, and then if approved, they are going to.
If I could add, they'll take the recommendation to you Monday. We may or may not have the resolution at that time, but we'll have it in the packet like we did that one last week. Hopefully, then it gets on the agenda the 17th and approved, and then we will turn around and we are going to have a department head and elected officials meeting, encouraging them to get their employees. See, the good old days, we could put this information in the paycheck. Well, nobody gets paychecks anymore, and nobody looks at the stub they get. So it is hard to. So we're going to ask the elected officials and the department heads to take care of that, and then we will have a series of enrollment meetings. There's always a series of them, those dates, but they'll be in the month of November, where we'll have a series of enrollment dates. and the Cigna people will be there, as well as the direct primary care people will be there, answering questions and explaining the different options. And then the new cards hopefully will go out in December, and the new plan starts January the 1st. So that's the timeline. We're looking at it. We're not pushing it. We're actually on time this year. Sometimes we're a little later in this, but it's still a fairly tough timeline. So just want to make sure everybody understood all that. Any questions? If not, I'm through, and
Chairman Crowd, do you have any questions? No. Commissioner Gilbert, do you have any questions? No.
Not this year. I'm just being as
We're
honest
locked
as I
in for a
can
year.
possibly be. Yeah. Yes.
If a lot of people take it, though, he knows. I'll be saying, hey, guys, we had this many people, and
I want to say, Mayor, that you are making efforts to move forward to try to get the families in
Yeah.
insurance cheaper.
it,
Asked around and talked around to some of the county employees, and that was their number one concern, was that their spouses, their children, how much more money they are paying for insurance than the city and the school board and different people like that. So,
and you think that's a lot of people, but only 8 people could have told you that, because only 8 people are on the family plan. 8 people. But they make you think like
And-
it's everybody.
And I'm one of them. My family is on
So,
the family plan, and I am one of them.
8 people are on family plan. Roughly 8. 8, might be 9.
Mayor, are you saying 8 people out of 650 or 550 employees?
Yeah, oh, I'll give you the exact number if you want to bear with me. But what we tell them, Tommy, what I tell them, and if they listen, is we're giving you free a Cadillac insurance plan. Well, if it's a Cadillac plan, the family costs a lot, because the family Cadillac is still a Cadillac. So it costs a lot, and we don't pay any of it. Cities isn't cheaper, but the city pays a lot of theirs. The taxpayers in the city pay a lot of their family insurance. So we tell them, if you can't afford the family Cadillac plan, then go to a independent agent or Farm Bureau or whoever and buy your family plan there, and you can get it cheaper than you can in this group plan. You're not getting the Cadillac, but they don't usually know or care. They just want that cheaper price. But you can get a family plan. So most of them have either got a spouse that provides the family plan, or they've gone and bought that family plan somewhere else, which is what they should do. We try to get them to do that. So at the end of the day, not many of the people that talk to you are paying that amount. They're just, on paper, it says it. This is a less expensive plan. It's still more than the city, because we're not paying any of the family plan, except we're paying their membership if they take option 4. But until we're able to do that, if we paid the amount that the city pays, $400 and something thousand, and I don't know about you, but I think as long as we can provide it free to the employee, you can buy it, or you can go buy something other than the Cadillac somewhere else. We've got other places that we need $400 and something thousand, I'm sorry, such as raises and that kind of thing. So that's where we've always been, the history there, so you'll know. They don't tell you the history when they're talking to you.
And Mayor, to echo that kind of sentiment, it is a Cadillac plan. I had family insurance through my private employer for many years. I mean, my entire adult life, and I switched when I got married with my wife and kids, and I was able to get family insurance here because my deductible went up. And you talked about the 4.6 increase from last year. Ours went up almost 15% at our business. My family deductible at our family business is $10,500 a year. The out of pocket for the family is $21,000 a year. And the family out of pocket here for the option 4 is $10,000, the same equivalent of option 1. So I did move my family to the $1,000 deductible option 1 because it would provide us a lower deductible. It does cost more but for what I'm paying and what my employer is paying for my insurance, it actually works out to where it's even a little bit cheaper. It is, to have that plan of what you're paying for, you might only see the part where you're, at my work, we pay about $120 a week for health insurance. But with that out of pocket, with that deductible being $10,000 for a family, I'm paying a whole lot more when my kids get sick. And to be able to pay a little bit more on the front end, not to have to worry about the back end, that's why I chose to take option 1 here and now. Thankfully, my kids aren't sick. They just got snotty nose and stomach bugs and things like that. And with the higher deductible plan of option 4, now we have an option to where they can actually see a doctor, be able to get meds, and be able to get healed quicker. And if, God forbid, something did happen to one of my children or my wife or something like that, we still have not, and it's not, to be honest with you, I hope that we never use the word catastrophic insurance, because at a $7,000 family deductible, that is not catastrophic insurance. That
Still
is
a decent plan.
that is a better plan than what I have available to me through my job. And the option 2, and I also would, with this option 4, get direct primary care. And most of the medicines that my wife, my kids, and I take, other than, and I'm one of those outliers because I wear an insulin pump, I wear a continuous glucose monitor and those things, but I still have the same prescription benefits as I would in option 1. It's just $5 higher, but I'm getting my other medicines for free. So for me, looking at the math, it would work out option 4, and I'm saving money because it is a cheaper plan than option 1 as well. So
If Lori could take that recording and play it to every employee, that's coming from the private sector, folks. And I'm saying this on behalf of the commissioners. When they're telling you something, they're not admitting that it's a Cadillac, and it truly is. I'm on it. I know what it is. It's a Cadillac plan. I understand that young person starting out making a low salary might not can afford the Cadillac family plan. Go to a private and you can get it cheaper. But here's another point that he didn't mention. Go to the private sector, any of them you want to pick. And I'll pick the best paying industry in Bradley County. That employee's insurance is not free. Ours is. We offer the Cadillac, we offer it free. Ask Vocker if theirs is free. My son works there. It is not free. It's deducted every paycheck. They don't realize those things, or they don't want to realize those things. And when they're talking to you, you need to know that. I give you yours free. Your family's expensive because it's a very good plan. If you can't afford it, I encourage you to go buy it somewhere else. But don't forget to say thank you for your free Cadillac. You see what I'm saying? I appreciate my free Cadillac. I've appreciated it every year. And that it aggravates me when people don't appreciate it, and they don't. But the ones, they dwell on one subject, and that's family, and the only time that's a negative subject to us is if they compare it to the city, and it's because they're spending all of that money to pay part of the family coverage. Don't know why they do, that's their business, but they do, and that gets thrown in our face a lot. But our insurance plan, don't let them tell you that they have better insurance there. Their plan's not better. We, every year, compare line to line, and one line might be a little better and back and forth, but we have as good, if not a better Cadillac than theirs. Theirs is a Cadillac without a bumper. Ours is a Cadillac with the bumper, in my opinion. But their family is less, not because it costs less, not because of any bidding situation. It's less because the city pays a huge amount. Now go to your constituents, which is who you got elected to serve, and ask them if they have free insurance. Most of my constituents say, I don't get free insurance where I work, because they don't. But yet, we provide it. I don't begrudge providing it. I want to keep it free to the employee. But I also want them to appreciate it. And that'll never happen. I've given up on that. It'll never happen. But it is something good that we can be proud of that we provide. Somebody says, well, I couldn't hire somebody because our insurance was too high. I said, why didn't you tell them our insurance is free? Oh, well, they're talking about family. Well, did they go down the street and get a price from a PAM or an insurance incorporated or somebody? No, well, they don't know what the family cost is. But theirs is free. Don't forget to remind them, theirs is free. Still free this year, even with, every year when it goes up, it's costing the taxpayers more to provide that free insurance. It's costing another, I don't have the sheet in front of me right now, but, I'd say a couple $100,000 to continue to provide free insurance. So Jeff Settenbecker is continuing to get free insurance, but the taxpayers are paying $200,000 roughly more for him to get that, continue that free insurance. Yeah, that's a sticking point with me because it's a good benefit that we don't defend and say it's a good benefit. We hear otherwise and we don't correct people, especially some of our elected officials don't correct them. Used to, they would send them to me, and everybody's giving up on that because they know that I'm going to tell it like it is. But all I'm going to do is give them the facts. Yours is free. Don't complain about how much your insurance is. And then you got options with the family. Option 4 will be another option that they hadn't had in the past, and that'll be a good one. But they may still want to go to a Farm Bureau and buy their own family plan. It may still be the best situation for them if they'll take the time to do it. Why we only have 8, I don't know. But I'm not even one of those anymore. I don't have a family, but I was one of the 7 or 8 or 9 all those years because I was too lazy to go get it somewhere else, and I wasn't the beginning salary person, so I could afford it, so I did it. But it's smart to go shop it. I say all that so you'll know it and say it to those employees when they come to you. I don't care who it is. If they come to me, the first thing they're going to hear is, you got a Cadillac insurance plan, it's free. They don't want to hear that, but that is true. Cadillac plan, and it's free. Now you have another option. It's still pretty good, like he said. I'm the one that called it a catastrophic plan because I didn't have the right terminology. It's a high deductible plan. Find somebody that's got a catastrophic plan, and option 4 is better than their catastrophic plan, I promise you.
Sorry to
So it
interrupt
wasn't
you,
the right
but
terminology.
to be honest with you, it's not even a high deductible plan. It's a normal. I mean, it's a low.
And that's why
in the business world, that is a low deductible
the
plan.
Cigna people tell me every year, you realize you have a Cadillac plan. I said, I realize that, and I want to provide that. I just wish they appreciated and accepted and all this, and they don't. So we could easily offer option 4 as the only option, and we'd still be offering good insurance and take care of most of them. But you can't go there. We have a lot of employees that have a lot of issues that probably wouldn't work for. I don't want to do that to them. I'm sorry. Even though they don't call and say thank you to me either, but I don't want to do that to them. So we continue, but hopefully we'll get more on option 4. Hopefully option 3 will go away because they can't be 80-something people that go to Park Ridge Hospital, but I think they've just never taken the time and effort to drop it. They're paying extra money that they don't need to pay. We don't need to have 4 options. It'd be better to have 3. So if we can get rid of option 3 and have 1, 2, and 4, that'd be great. And eventually, option 4 becomes our insurance. That'd be great. I'm not saying it will, but I think if more people buy into it, we'll probably always have to offer another option for some people that have had the heart attacks or have had the I don't know the situation. But there are situations that direct primary care wouldn't work for them. And starting out day one with those higher benefits probably wouldn't be the best for them. So I'll shut up and you tell them whatever you want to. Just keep in mind, they've approved recommending it. You'll get your questions from the full commission, whether it's Monday the 10th or the 17th, I'm not sure, but that's when you need to do your big spiel.
One Commissioner Blake.
Real quick, Mayor, or Pam, roads, as you remember, kind of did their own thing a little bit. Are they continuing to do their own thing, or did they come into this now?
That was another negotiation I've gone through, but they're continuing on their own. So
okay, so that's a Pam. With other clients, I guess that you have that are going in this direction, do you see a reduction in the number of claims from? Because you've got this option now, and they're taking care of the scope of incidents that they have, which now I don't have to go see the expensive doctor, so to speak. Does that reduce the number of claims typically?
Very possibly, yes. It's still kind of in the beginning stages of to be able to see good year-end results from that. But I've got quite a few clients who do have a membership with DPC. They like it. They like being able to go as many times as they like. But as far as the claims go, we have not been able to determine
So you don't
just
have
yet.
any data that would say that going in this route will reduce the number of claims? I'm sure that when you guys were negotiating with Cigna, they wanted to see the number of claims that we had in the past year.
Yes, when we looked at the Cigna numbers for this past year, the large claims are what they mainly look at, and that's where the bulk of your
So the
the
claims
claims are
that they
paid
would
are
take
your.
away, Cigna didn't really look at them. So
No, that they did not do an analysis on that. But I would say that after this year,
Cigna would
in a
take into
year from
account this
now, we
membership
will be
plan.
able to look back at a full year of usage to see what differences that might make.
This,
If I can jump in there, we think over time it will help us with the claims history, but the insurance company's perspective is primary care physicians aren't where our cost is. Our costs are on the open heart surgeries. I can't even think of the terminology for some of these serious, expensive claims we've had this year. Those expensive ones are what drives the cost, and if we can get those down, this will help, don't get me wrong, but they're quick to tell you primary care physicians are not where our cost is in our claims. So,
and Pam, if you would I'll put it on my calendar, but to remember next year, if we could look at that during this meeting to see what our claims are for this calendar year in comparison to the people that will sign up for option 4.
yeah, we could have brought it. I don't usually bring it to the committee, but we can. That's the first thing we look at. Before I ever get a bid from anybody, they bring us their claims history and they lay the groundwork for what they're about to do to us. Well, you're paying this much, I'll make up a number. You're paying $50, and according to our claims history, we're spending $55. You see what I'm saying?
Mm-hmm.
So you're at 107%. That's not the whole story, and I think they know I know there's more to that story than that, but that's what your claims history represents. And well, we start out with that, and then that claims history goes to all the bidders, so they all get the same thing. The key thing next year is comparing next year's to this year's, and we'll try to remember and bring that to you,
Please.
too. It's sort of out of my mind at this point because that was last month, but yeah, that's the first arguments we had. But
Well, I think the big thing is, and I think that Commissioner Blake was hitting on it, is we want to see how beneficial is this option 4 to the Bradley County employees that take it. What health benefits are they receiving by having direct primary care? I read in your packet and the stuff that you guys put out that is your goal is to not just take care of people when they're sick, but to have a lasting relationship that brings a healthy change in people's life, to keep them healthy for longer, not just mitigating the problem, in an emergency type situation when they have the flu. So I think that if more people will take this option and be willing to, come in and see you guys and get on a track of a healthy lifestyle, and try to help mitigate some of their illnesses or whatever they might have. I've mentioned many times today that I'm a diabetic. I also have high cholesterol. I also take heart medicine as well for high blood pressure. And so, that is the kind of things that I would love to be able to get off of. And I hope that by taking this option, we can find new solutions to be able to make that happen, not just for me, but for many people across as well. So, are there any other questions for the mayor? No. And Dr. Fretwell, I'll recognize you. I know you had some stuff you'd like to say.
Really, the biggest thing is, for us, we're into population health management. We're into prevention. That really, our name does not describe really who we are. You guys will hear more about it, and I don't want to take up your time, describing exactly what we do because it's next to impossible, in the medium. But ultimately, what we want to do is make an impact on the healthcare cost of our community. The healthier our community is, the wealthier we all are. Healthier workforce, no lost time, having a place for your people to go and not have to worry about costs. When you take costs, and those are the two things that we take out of the equation. The two biggest barriers to healthcare in America happens right here in Bradley County, Tennessee, is cost and access. You guys are taking away the cost. again, the mayor has worked really, really hard to make sure that this option is no cost to the employees. And then number two, the access, and that's us. We typically get our patients in the same day or next day, you know, if it's late in the afternoon. So we care about preventative medicine, and we care about the healthy workforce, and we do data analytics that we'll supply to you guys quarterly once we get going. So you'll actually be able to see exactly how much that you're saving with us, exactly how many people came in with undiagnosed problems, what we're treating them for, and how we got them to goal. When we do those things, that does absolutely mitigate your cost. Because if we can come in and we can find those disease processes that even sometimes your folks who are working here don't even know, and they don't go because of access and time, and we can get them to goal, we can keep them from having heart attacks or strokes or, you know, pre-diabetics, obese patients, folks who smoke, folks who drink, and help get them to a state of wellness. That's our goal. And that's what it is we do. Sure.
Yeah, most definitely. A lot of questions. After that, moving into number 4 is other business. There is no other business of this committee. Do we have a motion to adjourn?